The 5 dangers of vitamin D. In this video, I'm going to tell you what you really need to know about vitamin D, which is actually a hormone. What are its functions? What is it for? What is the correct dosage of supplementation? Does everyone need it? What are the dangers? And what happens to those who have very low vitamin D or very high vitamin D? What are these values? I'll tell you everything in this video. Let's start with the functions of vitamin D. I'm going to divide it into 2 groups. The first is the classic function, which is in the bones. You probably already know this function. It's the most studied, more than 100 years of studies about the importance of vitamin D, which increases the absorption of calcium. You can take advantage of the calcium in your diet. So vitamin D is crucial for bone health. If you lack vitamin D, you'll also have reduced calcium. As a result, your bones will suffer greatly, including an increased risk of fractures and osteoporosis. So vitamin D is very important for bone health, which is the most studied function. But it also has other functions called non-classical functions, which have been studied for 15 years. Not everyone knows about these functions, which are the functions in immunity, inflammation, with vitamin D acting as an anti-inflammatory, and also in cell proliferation. Vitamin D would also play an important role in the formation and protection of our cells. So these 3 functions are being studied a lot these days. There's another non-classical function that is also widely studied, which is vitamin D in cancer. Is vitamin D an anti-cancer? You've probably seen some videos online saying this, but I'd like to point out that while we have this suspicion, it's not scientifically confirmed. I can't tell you here that it has that function because when we analyze the studies, a larger study called a meta-analysis that brings together several scientific studies, this is not quite clear, this is not proven. So more studies are still needed for me to tell you here that vitamin D has an anti-cancer role. Why? There are multiple factors that can confuse us in this analysis. If you look at smaller studies, there are some that even make this claim and arbitrarily say that vitamin D has this anti-cancer function when it isn't proven. What's a factor that can widely confuse this analysis? Explaining a bit more to you. It's obesity. We know that obesity indeed is a risk factor for cancer, and obese persons generally have a lower level of vitamin D. So they would indeed have a higher chance of developing some type of cancer, but not because of low vitamin D levels, but due to obesity. So there's this confounding factor. When we remove these factors and analyze them, then in a study with a greater statistical potential, this isn't proven. That's the issue of vitamin D in cancer. I have to share the information as transparently as possible. I hope you understood. Let's talk about where I find vitamin D, what foods are sources of vitamin D, how I can acquire vitamin D. It's just as important as you knowing the functions, knowing how you can improve vitamin D levels, how you can acquire this vitamin. There are foods that are sources of vitamin D, such as fish, especially fatty fish, fish that have omega-3s, such as salmon, tuna, sardines, eggs, milk, animal products. The big issue is that most of the time, vitamin D from just diet alone won't be enough, so we also need ultraviolet radiation from the sun exposure, which also has several factors that can interfere with the absorption and activation of vitamin D. For example, many people sunbathe in clothes. This can impair absorption. The farther away from the equator, the lower the level of absorption of ultraviolet radiation. Depending on the location, you're also going to have many cloudy and polluted days, which could interfere with this. Skin pigmentation also plays a role in this. There are not various factors related to sun exposure. The more your skin is pigmented, the less it tends to absorb ultraviolet radiation to produce vitamin D. It's important to note that the sunshine that we utilize to benefit from vitamin D is present from 10 a.m. to 3 p.m. What would be a good exposure time? Well, it would largely depend on your skin pigmentation, but on average, 15 minutes of sun exposure on the entire body would suffice for you to achieve good levels of vitamin D. But I know that many people cannot get sunlight exposure during the hours that I mentioned. For instance, from 10 in the morning to 3 in the afternoon, I'm working in a lab coat at the hospital, so I can't move to a sunny location to leverage this vitamin D. In these instances, we need to resort to supplementation. I will discuss the doses also Just continuing with our subject here on the reference values for vitamin D. Good values would generally range between 30 and 80. I am indicating these numbers in the unit of measurement nanogram per milliliter. It's extremely crucial that you heed this because there's frequent confusion with the reference values of vitamin D. Because another measurement that's also utilized is nanomole per liter. To convert these values from nanograms per milliliter to nanomoles per liter, we should multiply by 2.5. So this would be around 75 to 200 nanomoles per liter. Pay close attention to the units of measurement. And why did I generally talk in the most common measure, between 30 and 80? Because there are some studies that suggest if you don't have any risk factors, if you're young, if you're an athlete, you could have values greater than or equal to 20, okay? But generally good or optimum levels of vitamin D would be around 30 to 80. Depending on the person, these values can change. Some metabolic conditions also interfere with calcium, like hyperparathyroidism, calcitriol production, vitamin D activation. I'm not going to go into too much detail here because otherwise the video would be too long, but it's important you know that there may be some exceptions to these reference values. And what would cause this vitamin D deficiency, this low vitamin D in the blood? For you to be able to keep calcium at optimal levels, calcium is crucial for muscle contractions and heartbeats. Without calcium, we cannot live. The lack of calcium is incompatible with life. So for you to live, we take calcium from our greatest source, our bones. Then we take this calcium from the bones and put it into our blood. And with that, your bones get weaker. Not to mention the non-classical functions of vitamin D. Well, that's still under research. So that's why vitamin D deficiency can cause weak bones, because you have to rely on this bone stock to live. Did you notice that I mentioned a higher value? What is the problem with you having more vitamin D than you need? The problem is hypercalcemia, because you can absorb too much calcium. I set that limit at 80. Some references put it at 100 nanograms per milliliter. You would already be experiencing these problems with vitamin D toxicity. If you ingest too much calcium and have an excess amount of calcium in your blood, you might face various issues like nausea, vomiting, weakness, dizziness. But it's not just that. Serious symptoms can occur, such as cardiac arrhythmias. Hypercalcemia poses a threat to cardiac rhythms and kidney functions, not just kidney stones, but also kidney failure. It's a very severe situation. So you might already be understanding that it's not exactly as people say. Just take vitamin D and you'll eliminate the surplus. Incorrect. That's a huge myth. You cannot expel excessive vitamin D through your urine, for instance, because, as I've explained, vitamin D is a hormone. So you need to be very careful with larger doses of vitamin D supplements because it can negatively affect your health in a serious way. And what are the doses of vitamin D, since I've mentioned it? In general, vitamin D supplement doses are around 1,000 to 2,000 international units. Some patients in some unique situations can't absorb this vitamin D supplement, so larger doses can be used, but the majority, more than 80%, will adapt to 1,000 or 2,000 international units. Do you remember when I discussed the tests? Here's a big discussion about international units because there's another measurement that's also used, which is micrograms. To convert from international units to micrograms, you should divide by 40. So 1,000 international units would be 25 micrograms. Micrograms have a symbol, which I'll show on the screen for you to see. And if you convert from micrograms to international units, you must multiply by 40. So 5 micrograms would be equivalent to 200 international units. And it's possible to make this conversion without getting confused with the values, because this often happens. Sometimes people think they're taking low doses when in fact the dose is in micrograms. When we convert to international units, they're actually taking a very high dose, including the risk of vitamin D toxicity. The most commonly used dose is in international units, but you need to be careful, as I explained here. I also want to point out, Do you remember I said it can vary from 1,000 to 2,000, in some people even higher doses than that? There are various factors in absorption, how you're going to benefit from this vitamin D. Since vitamin D is fat soluble, we need to supplement with the largest, fattiest meal. Some capsules come with oily capsules, so you won't need to do this. There is a protein that binds with vitamin D, which can also change this. And there's also the issue of vitamin D receptors. Some people have fewer receptors. They will need a higher dose. Some people have more receptors, can make better use of this vitamin D. They will need smaller doses. In some cases, even less than 1,000. So this can vary a lot. Only the doctor can determine this. The doctor is following your case. So don't assume you will supplement with such a dose or will take that dose or another, because you are watching a video which is not the objective of this video. It's to inform you and not for you to self-supplement or self-medicate. There are other nutrients also necessary for the function of vitamin D, like magnesium, zinc, vitamin K. But why these other nutrients? Because they also enhance the effect of vitamin D. The thing is, I said that we can't efficiently obtain vitamin D from food. Now the zinc, other vitamins you can get on a minimally balanced diet. I'm not even talking about a very good diet, but on a minimally balanced diet, you can get enough zinc from your diet to utilize this vitamin D. So, not always the supplementation of vitamin D should be accompanied by vitamin K2 or zinc, for example. That's another lie that's on the internet, suggesting you should take multiple supplements, when that's not true. In most cases, through food, you can absorb these vitamins. Now that you know a little about vitamin D, I'm going to tell you the 5 dangers this can genuinely bring about serious health consequences, 5 myths, 5 precautions that everyone should take with vitamin D. I'm just asking you to like this video. If you find it useful, let's set a goal of 5,000 likes. So leave your like. If you're not subscribed, go ahead and subscribe to keep following the new videos here. And the number 1 danger is neglect. Vitamin D deficiency is incredibly frequent. According to studies, it can be from 40% up to 97% in some groups. Seriously, this is extremely critical. And the only way to know is through blood tests. If you don't measure your vitamin D levels, you won't know their status, whether you are deficient or not, whether you need to supplement, whether you need to change anything. Because the symptoms, they are the symptoms that only appear when you already have a consequence like osteoporosis, fractures, bone changes. You'll hardly have any symptoms in the early stages when we need to act to prevent this. Then the treatment is much more complicated. So you need to have blood and vitamin D tests. When was the last time you had one? Do you know the values? If your doctor hasn't ordered these tests, talk to them, ask specifically about vitamin D and say that you want to know your levels. And if not, there's no way. Even if you're feeling well, often only after years of vitamin D deficiency will you show any symptoms. So don't wait until that moment and talk to your doctor to order this test. And the second danger is the dangers of too much vitamin D, of hypercalcemia. I worked for many years in the emergency room, and in recent years especially, complications due to hypercalcemia, due to excess vitamin D, were arriving in the emergency room with people with many symptoms, with kidney problems, with heart problems due to excess of vitamin D. And when I talk to them, what dose were you taking? There are people who take 5,000 international units every day, 10,000 international units. This without medical supervision is very dangerous. The tendency is for those who use 10,000 international units without medical supervision to really have complications and have hypercalcemia. You think you're doing your health a favor by taking supplements. We've already seen that it's a hormone, but many people don't know this and end up suffering the consequences. So be careful with excessive vitamin D. In the short term, excess vitamin D is more dangerous than a deficiency. See how important this is. So don't worry about thinking you're gonna lack vitamin D. First, consult with your doctor to find out the safe dose. And the third danger of vitamin D is not having patience. Why? We've seen that vitamin D is a hormone. So it can take 8 to 12 weeks for the result of supplementation or increased sun exposure to appear in the laboratory values, in the values of blood tests. So there's no point in starting to supplement and the next week or after 15 days you perform new tests because this result won't be reliable. And here it's a big catch. It's a big danger because a lot of people take the exams of vitamin D ahead of time. They end up seeing that that value has not increased or sometimes even lowered, and they end up increasing the supplementation, the doses of vitamin D. And then, when that time really passes, they end up going from deficiency to excess vitamin D. So give yourself time to really see the result. Be patient, don't increase the dose prematurely because that can be dangerous. And often when I talk to patients, I see this happen because some tests, like blood glucose, blood sugar levels, in 10 minutes we can already have a change in these values. But vitamin D is different, so be patient and get tested on time. And danger number 4 is not monitoring with periodic blood tests, because you've already seen from this information that the only really effective way to know the dose and blood values of vitamin D is through blood tests. So it's necessary to monitor these values and also adjust the dose, which can have serious consequences. And mistake number 5, I also see a lot in practice, is confusion with reference values and also confusion in vitamin D doses. And it can have very serious consequences if microgram doses are exchanged for international units. So always check if you order vitamin D to be processed. Make it very clear what unit you want, the unit that was prescribed. From 0 to 10, what grade do you give to this video? If it's 10, I'll make more videos like that. Also write in the comments which part of the world you belong to, which city you're watching me from, put it here, and I'll send you a hug. Now, I'm going to leave a suggestion for you to watch. It's a video I talked about fat in the liver. You know what are the best foods for those who have fat in the liver and the worst? Those foods that you will avoid if you have fat in the liver. Or if you're taking care of your health, watch this video here. I'm sure you'll enjoy it and learn more about fat in the liver. A hug. See you next time.